The Jupiter trial, however, doesn't have a monopoly on dubious research methodology. This is the Treating to New Targets study on statins, and it used something called a run-in period, which can lead to selection bias. Selection bias is where the participants in a study are not actually representative of the real world. Now, prior to the commencement of this study, potential subjects known to be sensitive to statins were removed. The remaining 15,000 eligible subjects were then all given statins despite the study not yet having started. And on the back of the run-in period, another 5,000 subjects were removed from eligibility, and I suspect the majority of these may have been due to side effects from statins. However, inexplicably, this information is missing from the paper. Ultimately, of more than 18,000 subjects initially recruited, only 10,000 ultimately took part. In no way does the study population represent the target population, the real-world population to which statins are marketed. And while selection bias is one way to disguise the true rate of drug side effects, another is simply to move the goalposts. This same Treating to New Target study removed any subject with liver dysfunction from the study, and they used elevation of liver enzymes of more than 1.5 times normal as evidence of liver dysfunction. They considered if your enzymes were over 1.5 times normal, you had a problem with your liver. And yet in the same study, the Treating to New Target study, when they reported on adverse effects of statins in another paper, this threshold for liver dysfunction had changed. It was now only considered an adverse event if the liver enzymes were more than 3 times normal. No wonder then that elevations in liver enzymes due to statins were reported to be relatively uncommon. Of course, problems in research go beyond biasing results. I've already touched on the failure to publish unpalatable findings. However, the problem might be deeper than you realise. Did you know that most of the raw participant-level data for statin trials is tightly held by an organisation, the Cholesterol Treatment Trialists Collaboration? And the Cholesterol Treatment Trialists Collaboration has close pharmaceutical ties and refuses to release this data for independent scrutiny. Which begs the question, what are they trying to hide? It's behaviour like this which resulted in much pressure being applied to the drug companies for better data transparency. And so, many pharmaceutical companies have now agreed to several data sharing mechanisms. Fabulous. The trouble is these mechanisms don't seem to be working. Researchers from the Cochrane collaboration wanted to update a meta-analysis on statins, and so they submitted requests to each of these companies using the agreed-upon data-sharing mechanisms to see if they could get the data. Merck and Novartis simply didn't respond, despite multiple emails, phone calls, reaching out, didn't respond. AstraZeneca declined to provide the data due to internal company policies, despite already having agreed to the mechanisms. Bristol Myers declined on the basis that they had only agreed to disclosures of research from 2008 onwards. Pfizer claimed they didn't collect any quality of life data, which leads me to another point. Absence of evidence is not the same as evidence of absence. If you don't go looking for drug side effects, you can't claim there are none. And Daiichi Sankyo declined on the basis that statin trials were specifically excluded from data sharing agreements. This might take on more meaning when you realise that Sankyo actually stopped researching statins in the 1970s because of side effects. Specifically, they found that the chemical, which ultimately became the first statin on the market, caused cancer in beagles in a dose-dependent manner. Presumably, No independent scientist will ever get to see that data because on top of excluding this information from the data sharing agreement, Sankyo has also implied that this information has been destroyed.